So I've dedicated this day to someone we both know quite well, Dr. Jain, who passed away 6 years ago. He was a mentor, a father figure, and he brought me into this world. So I felt that the most powerful way to commemorate and honor his soul and for what he's taught me and the life's work that I've put myself on after experiencing that deep loss was to bring all of the facets of what I believe he loved, which was medicine, art, science, and beauty.
We want to use tools now not to just treat chronic and acute disease, but ideally to prevent them. So better diagnostics and things that your mobile phone or even sensors in your car and house can track will be more useful for prevention. The Nobel Prize was won last month by a physician who developed a way to take a skin cell, for example, and reprogram it to be like an embryonic stem cell. So we have the potential now to make a bucket of our own body parts, in a sense. And so when you go to the doctor in the future, instead of me just giving you a drug, let's say for high blood pressure or cholesterol like everybody else, I'll look at your genetics and I'll go, your genes mean you should be on this dose and this combination as opposed to the one that somebody else is taking.
What's so amazing is how dynamic these biological mechanisms are. I'm a physician, I'm a professor of medicine here at the University of California, San Francisco, and we've conducted research showing that we can begin to reverse heart disease in just 30 days. That in 3 months you can change over 500 genes, turning on the good genes that protect us, turning off the ones that harm us.
There's been a dramatic change away from treating infectious diseases to chronic illnesses. And those are the diseases, ironically, that can be changed by behavior and lifestyle changes. The biggest burdens of health disease in the world right now are all these diseases that can be changed with just simple tweaks in behavior and lifestyle changes.
So in every way we measure, the more you change your diet and lifestyle, the more you improve in all these different mechanisms, but also the more you change, the better you feel.
So there was one psychiatrist for 1.5 million people. You know, it's a staggering problem. So we realized that we wouldn't be able to use a traditional Western model of addressing this profound need. So what we did is that we started a mental health or a community mental health training program. We trained doctors, psychologists, nurses, social workers in community intervention and community approaches. And so that rather than working one-on-one, we work with the community. We can now reach those 1.5 million people. So it works, and this is something we want to engage with now throughout the rest of the world.
Children really need a present, attuned parent. And even if it's for 15 minutes a day, but that parent is there on a consistent basis, then this can provide a psychological, healthy underpinning to the child's foundation. It's not that we don't want our children to achieve. It's when we are consistently focused on the outcome of achievement and neglect the process that we miss the moment-to-moment nature of parenthood. The parent first get connected to their own sense of inner self and purpose. Because when the parent is connected on an inner level, they begin to appreciate the child on their inner level.
Computer systems can do diagnosis much better than doctors can. They can do prescription much better than doctors can. So if you have a question, call your cell phone, don't call your doctor. People find it hard to believe, but your airplane is not flown by human beings anymore. It's way too complex for a human being to do, so we have autopilots. You know, most stock trading, which used to be done by human beings because it required so much judgment, got so complex that important trading is now done by computers. Any large innovation creates shifts. It almost always increases the number of opportunities, but it does cause shifts, and shifts are uncomfortable for people. You have some things that are better, some things that are worse, but on the whole, things will be substantially better.
Each one of us has the power to go out and make a difference. So find what's your calling, what is your heart telling you that you really want to go out and do. And once you get good at that, that's how you're going to improve the world. And each one of us can go do that.
My next thing again is a parental focus. The parent needs to learn to reflect more and be more in a meditative, reflective stance when they treat their children. The third thing would be to build a connected relationship with one's child, because when a child feels the glue of the parental attachment, then chances are that child will grow up with a resolute sense of inner self.
I started in 2003. Mr. Rahman found me, and there was no looking back. The rest is history. Sansani सनसनी नावलों, ये इश्क के बादलों, बर्फ से खेलते बादलों का शौक है.